Hello, I'm Ryan Ferdyhurt with the Center for Practical Bioethics, and this is the Clinical Ethics Corner. A foundation of modern medical ethics is the principle of beneficence, the obligation of the healthcare professional to do good for patients. This is a proactive responsibility, meaning the healthcare professional has to do something, which thus begs the question, how much is that healthcare professional supposed to do? Beneficence can be seen as two different ideas, obligatory beneficence and ideal beneficence. Obligatory beneficence is what is your obligation? What are you supposed to do? What is your responsibility? Ideal beneficence is going beyond your responsibilities, acting ideally. These two ideas can come into conflict in some interesting ways. Take this patient scenario, for example. The patient was in his mid-40s, had recently immigrated to the United States, and had been having difficulty and not had a bowel movement in over a month. The patient came to the hospital and was diagnosed with colon cancer and a complete blockage of his lower colon. He needed chemotherapy and he did an initial round but did not respond well to it. Because his colon was completely blocked, he would not be able to eat anything orally or receive a feeding tube. So the only way to provide hydration and nutrition was through TPN, intravenous hydration and nutrition. The patient would have to stay in the hospital for about 3 weeks until he is ready for another round of chemotherapy. The question then came, what is our responsibility to this patient? He is likely never going to be able to afford that round of chemotherapy or that 3-week stay in the hospital. What does this patient deserve? Would it be obligatory beneficence for this patient to receive chemotherapy, or would it be ideal beneficence for that patient to receive it? Does this patient deserve this treatment? It also comes to the idea of what is our responsibility to our fellow man and who is our responsibilities toward? Is our responsibility toward citizens, or is it toward patients, or is it toward the general idea of the larger good? Beneficence is a challenging principle because of the 4 major medical ethics principles, it is the only one that is proactive. This is going to become more and more challenging as more and more patients struggle with insurance, finances, and coming immigration status. This needs to be corrected in thought of what is our obligation and who is our obligations towards. Thank you. I'm Ryan Ferdyhurt, and this has been the Clinical Ethics Corner.